When people start getting injections for some cosmetic procedure, they're typically told, come back in 6 months or 4 months or whenever it starts to wear off, keep it going. Is there a benefit to not doing that, to interrupting it and letting the material, whatever it is, Botox or fillers or whatever, sort of completely deplete?
Sure, I think there's a lot of benefit to that from time to time, especially, nowadays, one of the things that we see is that patients can be a bit fickle, and they'll be in my office for a treatment, and then a few months later, they'll be in somebody else's office, and then they come back to me and they want something else adjusted. And sometimes it's hard to know, where the target is because they've still got some stuff in their face, right?
Oh, absolutely. Yeah. And sometimes the patients don't really know, and it's hard to get the notes.
That's
so sometimes that's one setting. I think there's a little difference too with, if you're maintaining continuity with a patient, I think
it's a different situation.
It's a different
right?
story between Botox and fillers, because the problem with Botox, of course, is if it wears off, then those frown lines. And I don't really see a huge benefit to that.
But there's so many fillers too, right? So some fillers last this amount of time, some fillers last that amount of time. Some fillers get injected in this depth in the skin, and some fillers get injected into a different place. So you're trying to hit a moving target, right?
Well, and also they last different lengths in different people.
I'm
sure you've seen many patients where, the filler was supposed to be gone in a year. 3 years later, it's still there.
Right.
And if it is,
it's also an issue if they come in wanting something maybe a bit more invasive or a bit more involved. If they come in wanting a facelift or another intervention, it's hard to know exactly what the starting point is, right? So I always tell my patients, it's important to know what your actual exam is, and it's tough to see that if you've got a bunch of filler in your face.
Very
right?
much so.
We need to wear it off and then let it wear off and then let me re-examine you.
Yeah, that's your best way to do it, because then you're going to really understand the natural structure, which is what it's all
more
about.
likely to have a happy patient at the end. And at the end of the day, whether you're talking about fillers or Botox, these are temporary improvements. They're going to go away. They're going to wear off. And so I think it's important to understand the difference between camouflaging what's bothering you and actually correcting it. I think there's a value in camouflage, right? If the patient isn't at a point in their life where they can have the laser treatment or the facelift and they want to camouflage their age-related changes, fillers and Botox are great. But if they really are thinking of it as a long-term solution, it's best to understand it's not.
Like any more information about this or any other subject in plastic surgery, theplasticsurgerychannel.com.